Okay, so it seems like we are live and welcome. I'm Dr. Gharadjedaghi, and today we will be talking about personality disorders. So every Thursday, what we will be doing is talking about kind of opening up this channel of communication on Therapy Cable, Facebook Live, and other social media channels for our viewers to ask questions and learn about different topics of personality styles, personality disorders. Now, I would like to state that most of my conversation is going to revolve around personality disorders as defined in the DSM, or Diagnostic Statistical Manual, that's published by American Psychological Association. Although there are certainly other types of personality categorization and nomenclature that can be discussed as well. There is something called Myers-Briggs type indicator. There is a PF16. There is a five-factor model under the acronym OCEAN that is being used in the industry. There are other types of personality models, such as Milan's personality models as well, that can be utilized. So, but for the most part, we will be focusing on the APA's DSM categorization of personality disorders. Now, starting off, what I can share with you is that the DSM really has an interesting way of splitting these different number of personality disorders into, which are basically, there are 10 of them, into three clusters. There is cluster A, cluster B, and cluster C. So what they have done is that they have noticed there's a commonality between three of them, called paranoid personality disorder, and the schizoid personality disorder, as well as schizotypal personality disorder. So, and they have put them into one cluster called cluster A, and then they have taken another four, which is the borderline personality disorder, antisocial, histrionic, and antisocial, histrionic, borderline, and narcissistic personality disorders into cluster B, around a commonality between those four. And then lastly, there are three more, which are the avoidant personality disorder, dependent personality disorder, and obsessive-compulsive personality disorder. And they have basically put them together as a means of the commonality between those three characteristics. So these three clusters are helpful in realizing more or less, if you will, some of the etiology and root causes of those specific groups. So the first one, cluster A, is revolving around what we call the odd eccentric pattern. And this odd eccentric pattern is exemplified by the features and symptomatology within each of these personality disorders that present a certain overlap and commonality. So, for instance, paranoid, people who really just seem odd, if you will, and with their paranoia, it is eccentric, it is excessive, and unusual, right? And same thing with schizoid. Very briefly stated. We will go into the depth and details of those, but individuals who tend to isolate themselves, they don't desire. I wanted to say appreciate, but it's probably more like a desire. They don't desire human connection, if you will, or groups or interactions with people. They rather be by themselves and withdraw from social interactions. And also may have some other odd and eccentric, excessive, unusual characteristics that we will talk about. And then schizotypal personality disorder, which also is characterized by very much out of the norm, unusual. Well, I don't want to say abnormal, but very much outliers in terms of very rare behaviors that we would usually not see in the general public. Like it's out of the norm, and also some eccentric way of thinking, unusual thoughts and beliefs in terms of perhaps some delusions, if you will, and maybe even hallucinations. And then in their behavior, in their expression, manifestation of these symptoms, they overlap and present this commonality that all of these signs and symptoms that people around them observe fall into this category of unusualness and eccentric behavior, odd behavior, and awkward behavior. So that's cluster A. Now, moving on to cluster B with the antisocial, borderline, histrionic, and narcissistic, you have a commonality of dramatic presentation, highly emotional, drama-ridden, drama-riddled, infused, drama-infused type of interaction, presentation, even in terms of both approaching society and people, as well as in their retreat, if you will, and withdrawing from society and people. And we will get into that, and with very simple examples of antisocial, which is really a misnomer. It should be called anti-authority, if you will, anti-norms, more or less. And people's behavior are characterized by lack of regard for norms and authority and rules that apply to everybody, and lack of remorse and empathy for others. We'll get into the depth of that as well. Borderline, having a huge emotional dysregulation around the notion of the threat of rejection and abandonment, and lack of appreciation and valuation in relationship. With histrionic, again, a highly sexualized and seductive presentation, manipulation of others in order to, again, remain in the center of attention, and this push for a person to present themselves as the main person in the relationship or in the room, and being highly influential and manipulative. And again, there's a lot of drama that comes with it. And lastly, narcissistic personality disorder, which is quickly said, it revolves around a huge, I would say, sense of, if you will, insecurity that is at the core of their identity and relationship with others, that can turn into two directions, more or less, both of them landing in the same destination, which is this heightened self-evaluation and self-admiration, and regarding everybody else as more or less extended objects. And so this is and again, in their interactions, presenting as very highly emotional, volatile, even aggressive, and again, marked at times by sense of lack of empathy, or misplaced or pretentious empathy. And then last category, the cluster C, is characterized by the theme of more or less anxiety in terms of the core issue or ideology and dynamics of these dependent, avoidant, and OCPD, which is different than OCD. It's Obsessive-Compulsive personality disorder, revolving around a sense of fearfulness. And to give you some examples, the fearfulness such as, it's not paranoia, it's more of a inner sense of worry, being worrisome all the time. And in this example, I can talk about, for instance, avoidant is a personality that is constantly worrisome about making decisions, taking responsibility, living with the consequences of certain decisions that they make. Therefore, that worry ultimately leading them to become dependent. I'm sorry, I said avoidant. This is the dependent personality disorder. Become dependent on other people to make decisions for them. So the constant worry of having to make decisions. So they escape that by depending on others. Avoidant personality, on the other hand, is more of a fearfulness around feeling rejected and basically not belonging, if you will, not fitting, not being accepted. It's a little bit different than what I had mentioned earlier in terms of the other personality disorders, for instance, the borderline, because the avoidant, the borderline has a lot to do with that emotional dysregulation, but the avoidant doesn't. The avoidant doesn't necessarily engage in that dramatic emotionality. So their MO becomes simply a preemptive approach toward everything in their life and mostly social interactions and people around them, to simply avoid interactions altogether. Whereas a borderline actually craves for interactions and loves to have interactions, and they're highly adept at actually interpersonal engagement, even though at times it is very dysfunctional. But avoidants are not. They simply they also lack the skills of actually more effective and functional interpersonal engagement with their society, with the people around them. So they become more lenient, and they create this type of pattern of avoiding social situations altogether. So they isolate themselves, and the difference between an avoidant and the schizoid in this case would be that the schizoid don't even desire social interactions, like we said earlier, whereas the avoidant actually desires social interactions. However, what happens is that they simply, for the fear of being rejected or not accepted, not fitting in, not being adept at those types of social interactions, they simply isolate. So very much, I would say, quite similar to schizotypal, with the difference that the avoidants, they do know social norms, social scripts, they do know how to act, behave, interact, and they don't have delusions, odd eccentric behaviors, hallucinations, things like that. And however, it's just about that constant fear of perhaps not being good enough, not being welcomed, not being accepted, not being really appreciated, and without really too dramatically, acting out. They just kind of prefer this, again, preemptive lifestyle of simply avoiding social situations. They're by themselves. But once in a while, when you see them, they do appear normal. They're not odd, eccentric. They don't have bizarre thoughts, ideas, and irrational, beliefs. So that would be the avoidant. And lastly, in the cluster C, again, that worrisomeness of the OCPD, or the obsessive-compulsive personality disorder, that revolves around the perfectionism, the sense of the worries around not being perfect, not being more or less in charge, in control, not being able to take care of themselves and of their lives due to deficits, mistakes, mishaps, lapse of judgment, and not having things in order. And that goes very well with the notion of OCPD, who constantly put things in order. So they're, without being overly concerned about the typical OCD, which is being concerned about germs and having certain phobias against certain, if you will, external factors that may affect them. Without even being concerned about that, we will get into the OCD probably later. They are about creating order, organization, in order to create predictability around them. So you would see OCPD individuals who are more or less workaholic. They work so much in order to make sure that everything in their lives are in order, basically in a predictable fashion. That includes their work environment, their home environment, their relationship with other people. So they can't necessarily handle easily surprising and spontaneous changes. They don't like that. They can't handle it. Because again, it kind of throws them out of control or out of the loop, or throws a curveball at them that they may not be able to respond to adequately, and it leads to that sense of inadequacy and again worrying that something bad may happen. So in order to deal with their, if you will, the obsessive worries, they come up with this compulsion around order and organization, and which requires a lot of hard work and kind of throwing themselves into this perfectionistic style toward life. And that works for them generally. So these are three clusters that we discussed according to the DSM. Most versions, at least starting version 3, TR forward. These are the categories that we discussed. Now, in the past, there was a push for what we call a recategorization, if you will, or actually dimensionality. So moving away from category separation of these disorders into 3 clusters, into 10 different personality disorders, and toward more of a, I would say, dimension. Let's say 10 different dimensions, and each human being would display certain aspect of those, which is really makes more sense. That's more of a natural way of thinking about personality. That how can we say that no, for instance, there is a human being if they are not displaying any narcissistic symptoms, if you will. Therefore, they absolutely are, if you will, devoid and free and clear of narcissism. How can we say that? Or even antisocial. Let's take that as an example. Every human being has some kind of a problem with some authority or rules or regulations. Everybody doesn't like something. There's, it's not possible that you find a human being that's completely, fantastically okay with every rule and regulation and authority that is thrown at them. That's impossible. So as a nature of human being, we tend to like and dislike certain things, including authority, including certain norms, rules, regulations that are applied to us. So therefore, if you think about it, that's a dimension of personality that applies to every human being. However, some individuals may score lower on that dimension of antisocial personality versus others, where their score, if you will, falls in a range that is becoming problematic in their lives. So ultimately leading to multiple legal, ethical dilemmas that affect their functioning, and that can include their mental health, their emotional health, their financial, career, interpersonal, even habits, if you will, and behaviors. So that's why this dimensionality model really makes more sense. However, it has not yet been accepted in the society, especially in the professional psychological psychiatric society, as an established and a better version of that model of personality. So now, just a caveat that, or a qualifier that I would like to throw in as well, is that personality disorders generally are determined based on what we call long-term enduring patterns uh, of presence and behavior and engagement by a person that have formed over many, many years, and also they are very resistant to change. Versus, let's say, just take another diagnosis in the DSM, which is, for instance, major depression. So major depression, or let's say generalized anxiety, those are things that are not necessarily part of a person's personality, and they're more linked to situational factors, some even genetic factors, more like medical, biological factors that can be treated to a point that they can simply disappear. And the duration of non-personality disorders to be treated and cured, if you will, is much shorter than if someone is actually suffering from a personality, an established clinical personality disorder. So to give an example, people who have antisocial personality disorders, if they have been formally diagnosed based on clinical interviewing history, psychological testing, and other evidence in their lives, they are hardly capable of really changing that behavior, especially because, specifically in this category, the society is not on their side. The systemic legal perspective or factors that exist in the society are particularly aversive and unforgiving. If you see many of incarcerated people, criminal population, substance use, people who are prone with addiction, and so through addiction, they particularly suffer from antisocial personality disorder. So we got a question coming in here. Legato is asking a question. Thanks for the question, Legato. So how can you maintain friendships with BPD or borderline personality disorder? So Legato and others who are chiming in and watching this channel, the question of how can you really basically maintain friendships without running away completely. I think that's the idea here, right? Because it's very hard, very, very hard to maintain, remain in a relationship with a person who has borderline personality disorder. And so definitely also with other personality disorder. I think that's the common characteristics, very briefly, that if it is an actual personality disorder, regardless of which category we're talking about, it's very hard to maintain relationships with them. So that's a fantastic question. Just let me answer that from first simplistically, and then we can get into the detail if you would like to know more. So simplistically stated, borderline personality disorder is prone to a lot of ups and downs, a lot of kind of commotion, a lot of more or less this constant moving away from one another and then again coming back together. It's this type of relationship with a borderline personality disorder is particularly hard to maintain, even though this back and forth exists. Specifically because remember we talked about this drama, the dramatic nature of BPD, a person with BPD, to say short, reacting so strongly, explosively, emotionally, and basically intensely. There's a high intensity in their reactions to their environment. And then vice versa, having been the receiving party and or co-participating party, let's say you're a friend of the person with BPD, you're not immune to also having to really engage in that type of a drama or style, if you will, intense interpersonally emotional interaction with others. So it's taxing, it's exhausting, it is driving a person sometimes to the brink of, just kind of sanity, where they may question their own sanity or the sanity of the other person. So in order to, again, as I mentioned, maintain that relationship, we first have to understand this and kind of come to accept what we are dealing with. You know, when they say whenever you want to fix something, you first have to understand what it is. So understanding what it is helpful, because then what you can do, first of all, is you can contain your own anxiety and your own difficulty with this person to this very specific type of interaction. So you don't have to, let's say, worry about them, doing a lot of other bad stuff or destructive stuff in the relationship that other people do. So to give a very quick example, there are a series of examples, but one of them would be, let's say, a sense of betrayal. Usually people with borderline personality disorder, they're keen on themselves not being betrayed. Therefore, so they pay more attention. They pay more attention to issue of trust, of trusting, of being trustworthy, and so forth, versus that, let's say, a person with antisocial personality disorder, narcissistic, maybe even, other clusters, some of the other clusters that we mentioned, may not really even pay attention to. So if you kind of can appreciate, the complexity of this matter and understand that, you don't have tons of other problems with this person, but particularly it's this emotional intensity, especially of going back and forth between being highly admired and then devalued the next moment or next day or next week. You can limit the damage, if you will. It's more of a damage control. So how can we maintain a relationship? We start with damage control. And then we move on with more of a mutual, collaborative approach, kind of a reciprocal negotiation. Some understanding on your part in terms of, learning some mechanisms, techniques, strategies about that particular person that you're dealing with. So you would more or less come to understand what are some triggers for this person that you can stay away from or be mindful about or be just simply more understanding of as well, and a little bit more forgiving, and even forgiving to yourself. And then, which brings up, by the way, the notion of self-care, which I will address very briefly, but also the fact that when you limit the damage and then you move toward understanding yourself, and then you can also ask the other person that you're interacting with to perhaps pay attention to some things that they do, that engage in, that actually are not to their own liking either. It may not be to your liking, but also if you just kind of probe questions, ask probing questions and find out whether or not they're happy with their own interactions with people. And if they do state, which a lot of times they do state that they're not that happy, you can provide these probing questions in terms of, what is it that you could perhaps think about changing about your own reactions, that would help you not getting too upset about other individuals or interactions. And kind of really this positive, plant the seed of this positive, more, benefit-oriented journey, right? So kind of plant the seed that what would be in their benefit? Would it be for them to have a little bit lighter life, more peaceful, less commotion, friction, or really have to deal with all those frictions and commotions and kind of come out as a winner, which is really in their real benefit, in their true benefit. So if you try to plant that seed, that would be helpful too. And lastly, what I want to share with you is the self-care. So if you this is very important, because what happens is part of that interaction with the borderline personality type of person, is the notion of codependency. So a lot of times people who are interacting with people with BPD, they are quite codependent in their own emotional self-care, in their own investment in the relationship with the person with BPD. So they have put too much, they have invested too much, they have put too much of their, if you will, marbles in the basket with this person that they're friends with. So and ultimately the pain that they're experiencing from these clashes and constant ups and downs translate into this sense of burnout and being drained or feeling lonely or feeling defeated or again betrayed or those type of perceptions, which doesn't necessarily have to be. It doesn't have to go that way if a person is willing to engage in their own independent self-care. So, give an example. If a friend that you're talking about is constantly involved in your life, so to the point where maybe, let's say, your buddy is going to the gym, okay? So you work out, you go to yoga sessions, you go to do cardio, and at different times play tennis, badminton, whatever it may be, and you are becoming codependent with each other. And then once there is a clash and difference of opinion, what happens is that you kind of lose your buddy or that workout party, and ultimately that affects you negatively, and you may not even feel like continuing your workout, right? Whereas if you did a couple of things, you would be able to get over this hump, get over this kind of spike. I call these spikes. In life with a borderline personality, at times you get these spikes, and sometimes they're very intense, sometimes they're low intensity, and you can get over those. It's like a bump in the road, right? And if you can kind of foresee it and deal with it and kind of brace yourself during the time you hit that bump in the road, it's just bump in the road. You just move forward. The life continues, friendship continues. You forgive each other. You learn something from it, improve a little bit, move on. So, and what I mentioned is bracing yourself. That's a good analogy for that self-care. So, if you're too codependent with your friend, then what happens is you neglect your own self-care as well. And but if you notice that, you know what, you can tell yourself, it's kind of this self-promoting type of a script, if you will, like a reminder, self-talk. Have this self-talk with yourself to remind yourself that, okay, right now you're going through a hardship, basically, another clash, another one of these intense emotional experiences. So that's fine. Let it be. It's going to resolve. Now, what do I do with my self-care? Like if I used to go to the gym, I'm still going to go to the gym. Okay? If this person is around or is not around, is secondary to the fact that I need to take care of myself and go to the gym. Now, and even if you're not really doing this activity with this friend with the BPD, but again, you are going through this spike of the relationship, what you can do is immediately remind yourself that I need to take care of myself emotionally and spiritually, and even physically, if you will. So have some plan in place for yourself that you wouldn't feel this loneliness and void and the sense of, rejection or attack perhaps and judgment and things like that, even though it's all real. But what you can do is address it by refocusing on the self-care. Like have a list of things to do, then being prepared for that. If you have planned ahead for this, then it becomes easier. Once it happens, you pull out that list and say, okay, let me see which one of these 10 different self-care activities I would like to interact with. So we are coming to a very close end. We were planning to do about half an hour. I know we started a little bit late, but right around 5:10, I believe. So we have been here for about 36 minutes, and I covered the personality disorders. I'm looking at if we have any questions or texts or information that anybody would like to know. I think we can continue this next week. We will have every Friday. Every Thursday. Today's Thursday. Seems like a Friday. I'm getting tired. from 5 to 5:30. I will be available for your questions regarding personality disorders, and it's on Therapy Table, and also will be channeled through YouTube Live and Facebook and other venues, digital venues. It was nice to talk to you. Thank you for listening, and we'll see you next week. Thank you.